Hi, I'm Dr. Mollie Marti with Resiliency Matters. Today we are speaking with Dr. David Rakel, professor and chair of the University of New Mexico Medical School's Department of Family and Community Medicine. David has practiced small town medicine in rural Idaho, and he was founding director of the University of Wisconsin Center for Integrative Medicine. Welcome, David.
Thank you, Mollie. Thanks for having me.
Yeah, I'm excited. We're also going to be talking about David's book, The Compassionate Connection. So that's really the focus of today's conversation. Let's start with telling our viewers, what is integrative medicine?
Sure. This kind of was born in the 1990s. Boy, that's 25 years ago now. When I think the public was getting a little frustrated with just the pill for every ill mentality of healthcare, and they realized that they wanted more. And people were starting to go towards more complementary and alternative methods. And so the term integrative came out of the need of bringing science to both and really integrating the best care possible for the unique individual within the context of their lives. And it really helped us get out of the pathos to suffer pathogenic model where we just study disease and really turn our focus towards how complex systems heal. And the term for that is salute or salutogenesis. And so integrative medicine initially came out of the importance of integrating both worlds, both traditional and non-traditional. And now it's evolving to more health and healing oriented outcomes, which is really what we want for our communities.
We want that for everyone who's listening today, and certainly across our communities. I'd say the premise of your book, The Compassionate Connection, is how we can use our very presence to promote health and healing in others. And in other words, how we show up can be as important or sometimes more important than what we do when we show up. Why did you write this book?
For that exact reason. You know, we give so much power to the thing. And I write in the book that if I was going to pick the best drug I had when I was in my rural practice, I would have picked Prozac, because people would come in and tell me the story of their suffering. And I would tell them that there's a reason for your suffering. It's called low serotonin. And I have a drug that I can give you to raise your serotonin. And then I would write it when we used to write it on prescription pads, and I'd tear it off and I would hand it over and the angels would start singing, and everybody, both myself and the patient, would give all the power to the Prozac. And that's a little myopic in that now the research is showing that Prozac for mild to moderate depression, not severe depression, not anxiety, but for mild to moderate depression works a little bit better than placebo. But the key there is both placebo and Prozac work well. And what's the ceremony of the process between a trusting relationship between two people that might have power? And the research is showing that that interaction, that trust, that caring, that compassion is probably where the 60% improvement comes from, because that drug only adds about 2%. Most of that healing comes between this therapeutic dance between two trusting human beings. And that's why the community that you talk about in your organization is so important, is we can't do this alone. We need to be there. We need to use our presence in the service of others. And in doing that for others, we do it for ourselves. So this book talks about all the science, probably too much science, but there's stories and there's science about how powerful this art of healing is. And often we give all the credit to the thing. And the thing is important, but it's probably a small part of the actual long-term benefits that usually comes from just caring about other human beings and walking with them to a better place over time. And that's why I love being a primary care doctor, is because I can do this over time. And that small increments of care over time can result in a tremendous return on investment after you work with someone over a period of time.
So let's talk about the self-healing mechanisms, because I think they do get glossed over in our medical or pharmaceutical driven world. What we're really talking about is using connections to help people better listen to what's going on within them and activate their own self-healing mechanisms. Talk about what are these self-healing mechanisms? What does that look like within that compassionate connection?
Well, I like to use a quote by Voltaire, and Voltaire said, "It's a physician's duty to amuse the patient while nature cures the disease." And I think there's a lot of truth to that, in that each human being, each living thing has this tremendous drive to find its balance. And that balance is a healthy balance between the living being and its environment. And when we're able to remove barriers, and there's some key ones there, and you know what these are, every human being does. They're eating multicolored whole food that was recently alive, good nutrition, moving your body, forgiving others easily, having social support and connection, and waking up each morning with a sense of meaning and purpose in your life. If we can facilitate those things in human living things, we sit back and watch healing happen. And we don't really appreciate the power of that, because some of these things aren't things, like forgiving others, right? My favorite quote on forgiveness from Jack Kornfield is, "Forgiveness is giving up all hope of a better past." And I love that. There's so many beautiful quotes. It's one of the hardest things we do, but it's a simple choice. And just that simple choice can result in such a better balance of our immune system, of our body's ability to self-heal. So Sir William Osler, one of the fathers of medicine, said it's a physician's duty to educate the masses not to take medicine. Not to take medicine. Because when we take medicine, we're actually influencing a chemical process in the body that might help one thing, but it cannot be confined to one part in the body, and there's always side effects. So 36.5% of people over 65 years of age in America are on 5 medicines or more. And we just simply don't know the potential harm once we get to 5 or more because they start to interact with one another. So we really have, more than ever, with the most expensive, most harmful, least effective healthcare system on the planet by far in America, and we can get into that if you want to. We have a need now more than ever to really look at the science of how we can improve value in healthcare delivery, and value is defined as less cost, better outcomes. And so we need to change the conversation to asking different questions. And you've probably heard some of these mantras. Instead of what's wrong with you, what's right with you? Instead of what disease do you have, what do you want your health for? And we worked with the VA to really try and incorporate this for our veterans, where they define their health mission, just like a military mission. And we use their health mission to create their health team for them to be successful. So there's all sorts of strategies we can do to really turn this very expensive, poorly effective healthcare system towards a better outcome.
And I love you referencing quotes, and and I think this conversation is helpful because it's between two people who are trained in the sciences. We're scientists, medical and social sciences, and yet we and we know the big words. So you say the body's trying to maintain balance, and we say, oh, that's homeostasis, and right, but it's not about that. And I think that you quoting, and I'm going to share something. You opened the door, Dave, on that. We also, in integrative medicine and in the work we do, we acknowledge that there are artists and poets and musicians and philosophers and theologians that bring these points to life in ways that people can understand them. And I was really struck by this, and I was thinking about our interview a couple days ago, and this came across from Richard Rohr, one of the meditations that I do, and he is quoting Paulo Freire from 50 years ago, and this is within the pedagogy of the oppressed, and it's so relevant to what's going on in Minneapolis today. My heart's with Minneapolis and across the country. But he wrote, "Dialogue cannot exist without humility. How can I dialogue if I regard myself as a case apart from others? mere its in whom I cannot recognize other eyes? How can I dialogue if I consider myself the owner of truth and knowledge? How can I dialogue if I'm closed to or even offended by the contribution of others? Self-sufficiency is incompatible with dialogue. At the point of encounter in dialogue, there are neither utter ignoramuses nor perfect sages. There are only people who are attempting together to learn more than they now know. And that really struck me as, you know, a 50-year-old writing in a very different context. But that is the compassionate connection. And I wondered if you could speak to that humility, because you write this for healthcare providers. It's about doctors not showing up to say, okay, I have the knowledge, I will use my knowledge to fix you, to cure you, but rather showing up to say, let's be in dialogue, let's have a conversation, let me learn more about you, let me, you know, shine light on things so you can find your way forward better together. But talk about that humility that's needed, and then well beyond medicine as well.
Thank you for sharing that beautiful quote. In that quote, you mentioned dialogue a number of times, and dialogue by definition is meaning running through two people. And in order for the meaning to run through the two of us as we're talking now, I have to first pause and recognize how my mind has been conditioned. So that's my implicit bias. So the humility comes in realizing we're all biased. We all have beliefs and judgment. But the humility says that even though I have beliefs and judgment, they may not be right. Or there's an opportunity for them to grow and expand, which your quote just beautifully described. And we grow and expand by bringing cognitive diversity to the table. Because that's the beauty of diversity in thought, is it makes us smarter. Because if we try and solve a problem with a bunch of people who went to the same school, had the same MD degree, who studied the same organ, we're probably not going to have an aha moment where we have insight into a new way of doing things that catapults us into progress. So having the intention of bringing people together with different thoughts, different cultures, different perspectives, different beliefs is such an important ingredient in us advancing to new progress in doing things better. And in writing this book, I researched a lot of different ways of communicating, and you know, there's debate, which means to beat down. And that doesn't require humility, right? Because someone has to win. Right? I'm preserving my ego. I am winning the conversation because what I believe is the right answer. That's a lack of humility. Oftentimes you'll see duologue, which is monologue waiting its turn. And I felt myself do this all the time, that, you know, you're talking and Mollie says something and, oh, I got this great story. Mollie, I just wish you'd stop talking so I could speak my truth. And so duologue lacks the dialogue because I'm not really listening to that other person. I just want to speak my ego, speak my truth. And I don't enter into dialogue, which is mutual respect of what can I learn from your experiences to make me grow, help me grow. And so thank you so much for that beautiful quote, because I think it really describes what we're trying to do together with mutual respect of every human being, because every human being has something to teach us. And I just am so grateful to be in a profession where I get paid by my friends to learn from them. and you get invited into these beautiful stories that when you really go into the authenticity and context of someone's life, the authentic reason for their symptom often comes through. And so often we just suppress it with our drugs without listening to the teacher, and the teacher is the symptom and it wants to tell us something.
And you talk about, and have touched on too, you know, really clearly, I think of them as these three strategies that can help us develop these compassionate connections. So you talk about presence, you talk about being aware of and overcoming our biases, And maybe you want to say more about those two. And then you talk about also being mindful of our body language as well as our oral language. So anything else you wanted to share or delve into those tips as our viewers are sitting here going, okay, I get it. It's important to connect, but what does that look like? Especially, let me say especially, it's hard to sit with someone who's in pain. It's hard to sit with someone who's suffering. We want to distance ourselves, or we want to just, say it's all good. You'll be fine.
Yeah.
So can you go a little deeper into what this looks like?
Yeah, thank you. And you're right, it is hard to sit with suffering, and it used to be a lot harder for me. And so I'm just going to speak from myself, because that's the only expertise I have. is I used to think that it was my job to fix everybody. And when you think it's your job to fix everybody and you sit with suffering, that gets heavy really quickly, because you can't fix suffering. You can't fix someone's suffering. And that's the difference between empathy and compassion. There's empathy fatigue, there's empathy distress. I would argue there's no such thing as compassion fatigue or compassion distress, because empathy by definition sees us as two different human beings. There's Mollie and there's Dave. And empathy requires by definition that I feel your pain and that I do something about it. Sympathy is I feel your pain and I go home. There's no action to it. So empathy requires action. And that perception is that I need to fix your suffering, and I can't fix your suffering. You can't fix anybody's suffering. I always like to ask who has a loved one in the room when I'm giving a talk. Everybody hopefully raises their hand, and then I ask who's tried to change that loved one in some way. And everybody raises their hand, and the next question is, how did that go for you? Generally not good. So empathy requires us to be different, but compassion is a different state of mind that's really helped me sit with suffering human beings in a way that doesn't drain me. And this is just a shift in our conscious awareness of how we can help another human being. If I get out of my mindset that I need to fix your suffering, I let go of that weight on my shoulders, and I move into compassion, which is Mollie and I are part of this interconnected dance where we are really not separate, and there's good science behind this, that human beings are intimately interconnected, whether they like it or not. And when I sit with you and help you, maybe just be there with you without even fixing you, and over time, we get to a better place together. And when I sit there with my positive intent to help you do better, I get better, because we're in this interconnected space. So when I go and sit with a suffering human being, I'm not, you want to match their body language, but I don't go in there thinking I have to fix you. I go in there thinking you're my friend, Mollie, and we both suffer. We're both human beings. That's compassion. Two people suffering together. Passion, the suffering. Compassion, two people suffering together. And we're going to start and be willing to go into this mystery, this great mystery that we're a part of called humans and life, and try and help each other. And when I go into a patient or a family member or a friend with that, I feel like my presence is more effective. And also it's a lot more fun. And actually, sorry, I could go on forever on this. There's some research between empathy training and compassion training. And then they looked at positive and negative affect in the clinicians who do this work. And after empathy training, depression goes up. After compassion training, depression goes down, and positive affect goes up. So there's actually some good research to show that our intention of going into this work together can really influence our own well-being. And I think this is why we're seeing so much burnout, particularly in primary care, is we have less time with people. And when we have less time with people, we order more things, we do more tests, and we order more drugs. And that gets us out of the meaning of why we went into this work. And so we talk about that as well in this book. I'll stop there. Sorry to blabber on.
Well, that's a good place to stop, because we need to get a word from our sponsors as well. But when we come back, we'll talk more about using our natural need for connection for healing. Stay tuned.
Today, more than ever, you need fast, reliable internet. At Mediacom, we want you to know you can count on us. Our fiber-powered 100% gigabit technology network was built for the future. We have enormous capacity and power and 99.99% network reliability. So even though these are uncertain times, we're prepared. And you can be certain we'll keep your world connected.
As the nation's doctor, I often get asked, what should I do if I think I might have coronavirus?
People who are sick should stay home. You don't go to an emergency room, you don't go to a clinic. You get on the phone and you ask for advice and instructions from your physician.
We don't want you to go into the ER or the doctor's office without talking to them first because you might spread coronavirus to someone else. Please visit coronavirus.gov for more information.
Thank you for virtual family dinners and long-distance birthday wishes. Thank you for sweet streaming melodies and spontaneous dance parties. Thank you for keeping classrooms together and learning alive. Thank you to our incredible network of employees who make all these beautiful connections possible.
Welcome back to Resiliency Matters. Today we're speaking with Dr. Dave Rakel, author of The Compassionate Connection. Dave, we're filming this as a special during the COVID-19 pandemic, and there's a lot going on, as we know, in healthcare and with our frontline workers. And now this, they're calling it the silent COVID, that all the implications that are following from people who didn't get the physical care they needed during some of this, and mental health. What words of wisdom or observation do you have for what's going on today with the pandemic?
Yeah, well, it's obviously a difficult time, and we're trying to just change our conversation a little bit from social distancing to physical distancing, because that's the fear I have most, is if this keeps us away from one another. Because when you look at the determinants of health, social connection and us being feeling part of a community is so good for our immune system. So if we socially distance, we actually may increase the pandemic because we don't have that support from one another. It has also allowed us to do medicine in a different way. Things like this, we do televideo visits now, that's allowing better access, so maybe we can touch people's lives more efficiently. And I think we also have to realize what technology can't do that only humans can, and that is that caring, it's the compassion. Computers do algorithms and guidelines really well. They can memorize things. And I think this whole pandemic is encouraging us to shift towards what humans do well, and then we combine that with the computers so we have a win-win opportunity. But it's really catapulted us to using IT more effectively for access, and helped us realize what we need humans for more of this social intimacy.
And in your book, you point out in a lot of ways how this need for these compassionate connections go well beyond healthcare, to anyone, a CEO or a manager with his or her people at work, or a parent with his or her daughter or son. What do you have to guide?
Well, the nice thing about studying health and healing, particularly between two people, is that works for anything. It works if you're a manager or a parent. And a lot of time, I think we both have 3 kids, and they've gone through difficult times in their lives, and it has never failed that when they're rebelling or they're upset, I just need to give them more of my attention. And one of my favorite sayings is, that to which you give attention grows. And if you want to have a good relationship with your kids or your family, your loved one, your employee, your patient, you have to give them your full presence and attention. And it really is that simple, to focus on one thing well, that other human being across from you, with the intent of how can I cultivate this soil in this garden for this flower to grow. And that's how I think of all my faculty, is how can I create an environment for them to prosper, to be fulfilled, to do good work for others, because I know they're going to do good work if they're passionate about meaning and purpose and what they want to do most in their life. That's true for any profession, any parent, anybody who wants to help another human being.
And I just want to touch on quickly before we wrap up the research on post-traumatic growth. And it seems that sometimes people feel guilty even for talking about this when it is a research-based area. You know, there are opportunities within great adversity to come through the other side more wise, or with more meaning or purpose, or deeper connections. What would you like to say about that?
I would be curious what you have to say. I'm just going to quote Leonard Cohen. One of his great songs is "There's a crack in everything, and that's how the light gets in." And I think we have a tremendous opportunity for this crack to let in a lot of light, for us to really develop insight into why it's so important to reduce the risk of chronic disease, which is mainly human behavior. That's what has made people more susceptible. Not all, not everybody, but most of the diseases we see now are due to human behavior. And that's not an easy thing to change, but we're most successful when we give each other our hearts. And that's difficult to quantify, but you can feel it when it happens.
But we'll keep trying, the researchers in us. So viewers, when we tape in studio, I give you 3 tips, you know this, takeaways, and we haven't done that when we've been taping virtually during the pandemic. But I do want to give you a tip, or perhaps it's a challenge today. How might you give someone the simple yet profound gift of your presence today? Don't interrupt. Don't compete or compare. Don't fix. Don't judge. Don't push down or push away others' feelings. Just be with someone, communicating with all that you are. You matter. I care. You're not alone. Thank you, Dave, for this conversation. Thank you, viewers, for joining us on MediaCom NC22, your local programming leader. Take care, and remember, we thrive together.
Nobody likes an awkward silence, but you can actually use it for something good.
You haven't really been yourself lately. Are you okay?
Find out how you can help a friend with their mental health at seizetheawkward.org.